Well, we're going to talk now to the World Health Organization. Dr. Margaret Harris joins us from Goma, in fact. Thanks very much for being with us on the programme. I know you've been calling this a global emergency for several weeks now, but how worrying is this second death now in Goma?
Well, we've always been very concerned about any person arriving in Goma with active Ebola, because indeed this is a huge city of close to 2 million people, and it's the gateway to other countries. There's a land border that's very, very busy. It's one of the busiest crossings in the world between RDC and Rwanda, but it's also a hub for flights to other countries and to the rest of the country. So, indeed, we've been preparing for a long time.
So what needs to happen now? Because I know there's been a lot of controversy there, hasn't there?
Identified.
Sorry to interrupt, but I know there's been a lot of controversy there over the use of a second new but experimental vaccine. Now, the first vaccine that's in use has been effective, but it's in short supply, isn't it? And the second one needs 2 shots, which is perhaps hard to administer and track, particularly in rural areas. Do you think it should now be used, particularly with this latest news from Goma?
So we actually do have adequate supplies of vaccine, and we've been tracking the supplies of vaccine. It's true, it has to be, we've had to scale up production, and the company doing that has been very helpful to increase the supplies. The second vaccine is an experimental vaccine that hasn't reached the third stage, where it's tested to ensure the efficacy during an outbreak. So we as WHO are very happy for all other vaccines to be tested thoroughly, but the science must be good.
Isn't it too late for that, though? I mean, with the number of cases going up as they are and the worries over how quickly and how fast this could spread, that actually you've got to use everything at your disposal?
Well, we do use everything at our disposal, and the really important point is identifying all the people who are infected and ensuring that they get vaccinated. So one of the big struggles is not acceptance of the vaccine. We've got 95% of people wanting to be vaccinated, but it's finding all the people who have actually been infected. People still fear being identified as a contact, and it's those few people who go somewhere else and infect another community and further seed the outbreak. So the really crucial tool is the ability to communicate with, engage the community, and build trust. And that's not, there's not an easy thing to do. There's no magic bullet when it comes to community trust.
Dr. Margaret Harris, WHO spokesperson, joining us there live from Goma. Thanks very much for being with us on France 24 today.